You can do that.
You have to sound turned off here.
Well, you can hear it.
Call meeting to order. Please stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening and welcome to the Tuesday, April 14th special meeting. Ask City Clerk to record attendance and council, except for Leah and myself. The rest, please stay present when Bonnie calls your name.
Bacon?
Aye. Here.
Present. Or Brink?
Present.
Corbett?
Aye. Here, present.
Hanson?
Present.
Niemeyer? Councilmember Niemeyer? Tilton Byrne?
Present.
Wendell?
Present.
Okay, thank you. All right, I just remind everybody, like I did a week ago, that if you come up to speak, the mics are live, so you don't have to touch anything or turn it on, and please don't touch it, because they're cleaned and sterilized and everything else. So, okay, some of you are familiar, but just so everybody's on the same sheet, the Brookings City Council allows comments on the first reading. A lot of places don't allow that, and we do. So, but what we're going to have to do in order to get to that point is I'm going to need a motion from the council to motion and a second to open the public hearing. Council, do I have a motion and a second?
So moved.
Close enough for motion and a second, Bonnie?
Mr. Mayor, we need a motion to accept the agenda.
Oh, I'm sorry. All right, let's go back to a motion to accept the agenda.
So moved.
Get them?
Yep.
All right, now we'd have a motion and a second to open the hearing to adopt the stay-at-home ordinance.
We need a vote. We have a motion to approve the agenda.
Getting tired of trying to keep me out of trouble. Anyway, all right. Please call the roll on adopting the agenda.
Brink?
Aye.
Corbett?
Aye.
Hanson?
Aye.
Tilton Byrne?
Aye.
Wendell?
Aye.
Bacon?
Aye.
Niemeyer's present.
Thank you.
All right. Thanks, Bonnie. Okay, so at this time we need a motion and a second to open the hearing to adopt the stay-at-home ordinance. Do I have a motion to?
So moved.
Okay. A motion. Do we have a second?
Second.
Okay. We have a motion and a second. So at this time, then, ask the city manager to bring forward the recommendations.
Thank you, Mayor, City Council members. The original COVID-19 ordinance was passed March 23rd and calls out what residents and businesses cannot do. If you go ahead and progress the slide one. This ordinance was enacted as a response to the health crisis in an effort to slow down the spread of the COVID-19. The stay-at-home ordinance 20-006 is presented as a plan in the next step in the city's response. Staff recommends taking public input and evolving the language if necessary. The action tonight does not enact the law, but only offers an opportunity for discussion. Insight from the community and local healthcare professionals will help in determining the appropriate time for implementation. However, when council does take action to enact this ordinance on the final reading, the intent would be to flatten the curve and provide our healthcare system with necessary time. The stay-at-home ordinance regulates what a community can do. More significantly, it outlines activities, services, and businesses that are essential and provides guidelines for what's allowed. A stay-at-home ordinance is more restrictive and limits activity outside of the home to only essential tasks. Go ahead and progress to the next slide, Bonnie. Residents can do essential tasks when stay-at-home ordinance is enacted while respecting social distancing as a requirement. Examples of essential tasks include traveling to essential employment for work, going to the grocery stores, obtaining medicine, fueling your car, dropping off kids at the daycare. The city strongly also encourages outdoor activities and promotion of good social distancing, such as utilizing our hike and bike trails, golfing, gardening, walking a dog. Once again, keeping that good social distancing of 6 feet or more. Examples of what residents can't do during this ordinance: host and attending large gatherings greater than 10 and within proximity less than 6 feet, browsing rather than shopping for essential items, and utilizing closed park equipment. Next slide. Thank you, Bonnie. When comparing the existing ordinance to the proposed stay-at-home ordinance, both are very similar at its surface, but the stay-at-home ordinance does allow businesses to operate based on the ordinance language and federal guidelines provided within the packet. It does close non-essential businesses and it concentrates on staying at home but for essential services by residents. Both ordinances still allow takeout and delivery of restaurants. Medical services are allowed. And the provisions within the specific existing ordinance are still intact. The stay-at-home ordinance is similar to the existing ordinance but concentrates on essential needs. It focuses on residents staying at home except for essential tasks. And finally, the regulation incorporates good social distancing practices. The stay-at-home ordinance is presented for the first reading. After taking public comment and council discussion, a motion from the council to approve the first reading will be requested, and then either a motion to go ahead and table this item for a second reading, or to go ahead and hear it at the next city council meeting is requested from city council. I've been asked a couple times on how we would enforce such a stay-at-home ordinance. It all depends on when this law is enacted, and the enforcement would be determined on how the community follows the law and the extent of the outbreak as well. Ultimately, it's up to the discretion of the officer, but we would prefer to give out warnings and educate people first rather than giving just a fine. The fine would be up to $200 a day or by occurrence. And we encourage residents who are interested in the stay-at-home ordinance and maybe have more questions to go to our website, www.cityofbrookings.org, to view our frequently asked questions. We do have a COVID-19 tab, which has all our resources available, as well as our partners from the Chamber and Brookings Economic Development Coalition. And then finally, by Thursday, if this ordinance should go forward and be tabled or have a second reading, it's staff's intent to go ahead and have a fillable form where residents or businesses can submit to the city a request of whether or not their business is essential. And then we could have a fairly quick turnaround time on that analysis. With that, would also mention that tonight is the first time we've ever had an opportunity for people to submit comments online via Granicus. Would just note to the people at home and those here in the audience that we do have 18, if not more, comments already that people can view as a public part of this process. So with that, turn it over to the mayor for any potential questions and open up the hearing.
Okay, thank you. This time I'd open the public hearing, and before everybody rushes up, city manager, I believe, has public comment from an individual to share.
That's all right. Thank you, Mayor. I did have a submission from Bonnie Specker, Dr. Bonnie Specker, to be presented to the city council meeting tonight. And I received her outline, and I'll just read her comments for the public. So this is speaking on behalf of Bonnie. I received my PhD in epidemiology from the University of Cincinnati College of Medicine almost 40 years ago, and have been teaching epidemiology and conducting epidemiological research since then. Every course in epidemiology I have taught, we have spent time on the 1918 influenza outbreak, just as professors and students will spend time on the COVID-19 in the future. Both the influenza of 1918 and the COVID-19 are diseases that did or will affect millions of people. In both cases, these diseases were caused by a new virus that no one had immunity against. Everyone was susceptible. There also are currently no vaccines that can protect people against the SARS-2 virus, the virus that causes COVID-19. Because of this, the only way to control the spread of COVID-19 is to use good hygiene, but also to isolate individuals who have been exposed and quarantine those who are infected. Another important method to control the spread is by limiting public gatherings. In the 1918, we were in the middle of World War, and public gatherings were not limited. leading to the spread of the virus that ended up killing 50 million people worldwide and 670,000 in the United States. The fatality rate, or the percentage of individuals with influenza who died, was about 2%, similar to the COVID-19. Although the virus causes the common cold is the coronavirus, SARS-2, the virus that causes COVID-19, is very different from those viruses. SARS-2 virus, along with the SARS and MERS virus, affect the lower respiratory tract rather than the upper respiratory tract, making them more fatal than the common cold. This is a disease that spreads quickly and is much more fatal than the common cold or the flu. It is estimated that every person who develops COVID-19 will spread the disease to 2 or 3 additional people if there are no controls in place to limit its spread. Although the SARS-2 virus is less fatal than the SARS and MERS, as shown by the lower case fatality rate, it is more easily spread and will result in a larger number of infected individuals and deaths. I gave this talk to Altrusa Service Organization in Brookings March 3rd, almost 6 weeks ago. At that time, there were slightly over 87,000 cases of COVID in about 60 countries worldwide. Today, there are almost 2 million cases in 210 countries. 6 weeks ago, we were less than 100 cases and 9 deaths in the United States. Today, there are about 600,000 cases and over 25,000 deaths resulting from COVID-19 in the United States. Although the number of newly diagnosed cases in the world and the United States are leveling off and might be starting to decrease, this is not true in South Dakota. The first case in South Dakota was reported on March 10th, 5 weeks ago. Today, 988 cases have been diagnosed in South Dakota, with over 250 cases diagnosed in the last 48 hours alone. These 988 cases are only the tip of the iceberg. Testing kits for the virus are in short supply, as are the swabs and media that are needed to test the individuals suspected of having the virus. There are definitely more cases in South Dakota than the numbers indicate. Currently, only individuals with severe symptoms are being tested. It is hard to stop the spread of the disease if you do not know who has the disease. Eventually, a high percentage of the population will be infected with this virus. The majority of those people will have either mild to no symptoms. However, about 10 to 20% will have moderate to severe disease, and a percentage of these will require ventilators to have a chance of surviving. If 1% of South Dakota population develops this disease, there will be about 1,700 severe or critical cases. If these all occur within a short period of time, the healthcare system will be overwhelmed. The most important key to minimizing deaths with this disease is to slow down the spread of the disease. This will reduce the demand on the hospitals and the infrastructure needed to support the severity of diseased individuals. Because there are so many people with undiagnosed disease, the disease can spread rapidly in a community. This has been seen in Sioux Falls, where there has been an increase of more than 600 cases in the past 10 days. South Dakota is in the early stages of this pandemic. So far, Brookings has relatively low numbers diagnosed cases, at last compared to Sioux Falls. The graph shows a cumulative number of cases in Brookings County. Community transmission is occurring, which means that the cases are being exposed to the virus in the Brookings community. Fortunately, the community transmission is currently minimal. The most important way to slow down the spread of this disease is to minimize interaction among people or to increase social distancing. The county, city, and many of the organizations within our community have done an excellent job at slowing down the spread of COVID. However, there are many additional interventions that can be instituted to slow down this disease and prevent the type of outbreak that is currently being seen in Sioux Falls. The local government needs to be able to institute interventions quickly. A matter of hours is needed, not days, definitely not weeks. Viruses don't wait for anyone.
Okay, thank you, Paul. We'd be able to post that on our website.
Yeah, I believe that could
Really
be
an
part
excellent
of the
presentation.
Granicus.
So, okay, thank you. Okay, anyone care to speak? Public comment are now open. Okay, be sure and introduce yourself, and you know how that goes.
My name's Kevin Grunwald. I live in here in town. She said to list their address. It's 817 4th Street in his historical district. I just had a couple, questions that I've heard and talked to a couple different people. So obviously this is a discussion, so it's not a target at anybody. It's kind of more, I'd like to ask a couple questions, have you guys
Sure.
maybe reiterate back, it's like your thoughts, if that's something that works for you guys.
Certainly.
And more so just what people that maybe aren't here, that I've kind of read a little bit, what their thoughts are too that couldn't be here. One was, what's the reason behind trying to implement further stay-at-home ordinance? You know, we have our basic ordinance right now, as it sits right now. I've read both. There's a little bit of a difference of stuff, but why go this extra step? Why are we doing more right now in that regards? I
Okay.
guess initially.
You want to speak to that, or?
Sure, and I think the intent of council is to go ahead and have this first hearing, listen to public comment, and then table it. So they're not, I don't believe, looking to implement it right now. I believe when they do decide to implement it, it'll be based on information from the healthcare providers within this community and what we're seeing in the horizon. Does that answer your question?
Yes.
Okay.
The other thing too is why are some businesses in our community being selected to close but not others? For example, factories. You know, the largest sort of all of these groups of people are in these factories in our community. Yet the salons are still, they can't implement, they can't. I would say a small, salon. You know, that's a couple people coming in. You know, the chairs spread out. But two different examples. But the city is selecting, what is or is not okay. I mean, everybody's feeling a hurt in our community, as we are all over the U.S. What is the regards in that demeanor of why are we having these selective
Certainly.
groups? And whereas the factory is a large one.
Yeah, I'm sorry. Go ahead.
Sure. When you look at salons or barbers, for example, the intent behind that is because of the proximity that the worker has to be within the customer for the amount of time that they're working with the customer. So good practices of the 10-foot rule can't be observed through there, and it's not declared an essential service. Steve, I don't know if you want to comment any further on that. And when it comes to factories, the federal guidelines do detail what is essential, what isn't essential. Not all factories are declared essential, but that guideline does determine or give us some guidance on what should be and shouldn't be.
I would agree. It's the 6-foot distancing guideline, which just can't be met, with the personal services in that regard. Whereas the factory can be problematical. However, there is larger space opportunities to separate between people.
That makes sense.
Okay.
Thank you, guys. Then why tell the public that you're extending the restrictions on the last meeting, yet two essential non-functional businesses, I would say, open up the golf course and the liquor store? Was you guys had a meeting regards it, people brought it up, and then you guys extend the restrictions, and then all of a sudden, that very night, we're going to open up the golf course and liquor store. Why? I mean, I feel like that was a real, it doesn't feel like that's a real essential need that we need in our community. I mean, in Alaska, the reason they don't allow liquor is because people are kind of out there and they're sheltered on their own, and things come up. And depression is a big issue, yet the city chose to implement, hey, let's open up that liquor store in the golf course.
Yep. Legitimate question.
Sorry.
I'll ask who's in
Sure.
charge of operations. So.
Great question. The reason why that was closed wasn't because of the law or the ordinance. The reason why it was closed was because I made the operational decision to close it until we made sure that we had practices in place to protect not only the customers but also our employees. And so what, from the liquor store's perspective, staff went back, looked at CDC guidelines, as well as OSHA regulations, came back with a plan to limit touching as much as possible, the exchange of products. In fact, people aren't even allowed into the store other than the vestibule when they first come in. So if you look at it from a very high level, I can understand your question as far as businesses not opening when other businesses are closed. But when you look at the facts, both bars, restaurants, and convenience stores, for example, are allowed to sell off-sale packaged beer and wine if they have the appropriate license. Grocery stores and other retailers are allowed to sell beer and wine with the appropriate license. So the liquor store is a retail business, does have the appropriate off-sale license, and therefore is very similar to all those other businesses. So it's more of an operational decision. Golf course, same reason. What we did is went back to the golf Association, as well as the NPZA, I believe it's the right term, the National Parks Association. And they had across the nation best management practices, how to ensure and lower the risk to not only the employees, but more importantly, the customers. So with the golf course, some of the things we did was added foam into the holes, so you can't pull out. First of all, you can't put your ball into the hole and potentially infect people. Can't pull out the flag. Golf carts can only be rented to one person unless you have a family. Then it could be potentially two. Have to be sanitized before and afterwards. Range balls, for example, have to be washed before they can be used again. People cannot come into the clubhouse. They'll pay for things through a window, but they can come in the clubhouse to utilize the restroom if necessary, but then it gets sanitized afterwards. And so some of those best management practices were put into place before we can open. But once again, the current ordinance doesn't prohibit from any of those businesses to open. I chose to close them down to make sure that we had proper protocol in place.
Okay, thank you. And then, so how many cases does it take to implement the stay-at-home ordinance? Like, you guys' thoughts in regards to, like, if we're going to proceed to advance this, what is the reasoning behind it, the logic? Like, 100, 50, 25? What is has that been a discussion in regards to everybody's concern for the future?
Good question. I'll turn it back to City Manager, who's been
Thank
talking
you.
to the epidemiologist. So,
And I think a lot of it depends on what the council, what their temperature, what their thought is on this subject as well. We listen to the local medical providers, and we hear a number of things that could be the triggering point. It could be anything from the number of beds in the hospital that are being utilized to the spike in cases as well. Talking to professionals, we know that once we see a spike in some of these cases, it could be the mockingbird in the coal mine telling us to be ready for what's to come. And as these cases tend to multiply really fast because people can get this virus very easily, it's essential that we nip it right away as soon as possible. And so we've put those people on our speed dial and asked them that if they see some of these triggers from the professional perspective, to give us a call immediately so then I can notify council, potentially set up a meeting and start moving that forward. So it's going to be a lot of different variables, but at the end of the day, I think it'd be important to hear from council too, their perspective on this.
Can I, Mayor, answer Kevin's question from my perspective?
yes, please do.
Hey, Kevin, this is Nick. And I just wanted to give some insight in terms of what my perspective is. I don't think I have a magic number of confirmed cases in Brookings County that I have circled, but to echo some of Paul's statements, I think we're all trying to gather as much information as we can from experts in medicine and public health and epidemiology and emergency management to give us a sense of where are the triggers that should send alerts to us to take further action. And so some of those would be evidence of substantial community spread according to the Department of Health. You know, right now in Brookings, we've got minimal or moderate community spread. An outbreak in a single facility or in a certain sector might cause some alarm. I'm sure we're all following news reports about what's happening at the Smithfield plant in Sioux Falls. I think it makes us aware of how quickly COVID-19 can spread in a facility or when large numbers of people gather, or if there's concerns that are raised from our health system related to capacity issues. Any one of those factors or multiples of those factors, for me, could trigger further action, and I'm just trying to keep track of all of them as we decide whether or not to take a next step.
Thank you.
This is Holly. I could comment as well. I actually have similar thoughts Nick has mentioned. I think that most of the council members, if not all of us, have been in contact with members of our medical community, our scientific community, experts in the field, and continue to track what the State Department of Health is telling us regarding cases. Some of the key factors that I have been looking at, much like Nick, include the number of positive cases that we've seen, the rate of increase in which that is happening, the impact of community spread, outbreaks in any one particular place within our community, and then, of course, really taking in the guidance from our medical and scientific fields that are specifically studying what's happening around this pandemic. And so I too don't have a firm number that I am looking at. Rather, it's a holistic approach, considering all of those components as we take this head on.
This is Patty. I'm sorry, were you done, Holly?
Yes.
I don't need to reiterate what both Bonnie and Nick have, or Holly and Nick have said. We have all been working very hard to get the advice of the professionals in the healthcare field, and we're very blessed in this community to have such a high level of expertise, as you could see from the information that was presented from Bonnie Sprecher at the beginning of the meeting. And I think, to give you a good example, I don't know about you, Kevin, but I'm very visual, and so to arbitrarily pick a number, like say, when we hit 20, that doesn't work, because by the time we hit 20, 10 to 15 of them might have been back in remission and healing. So we can't use an arbitrary number. It has more to do with, as was explained, when we hit that, if we hope it doesn't, but if we should hit a threshold where a significant number of increase within a couple of days is what's going to trigger us. And that's why I don't think any of us are interested in putting arbitrary numbers to this, but we're trying to be as responsible as we can, looking at all of the data.
Thank you.
Kevin, I've asked the other mayors of the first-class cities, what they're using, and some of the same answers you just heard from the council members. It's, nobody knows what the answer is. And of course, Sioux Falls mayor certainly didn't know when this started. So,
and I guess reason I was going at that is, my concern is that if we currently have 3, that we had 6 in remission. I'm aware that we have 3 right now as it sits. I called Bonnie yesterday, talked to her, and she said that we have 3 active cases and stuff. But as we get closer to the May 6th, and we don't have any, or we have 3, my biggest concern is the fear basis of us extending another month, moving on, versus us getting back to a stepping stone where we get back to where we are norm. Obviously, everyone's going to still have their distance, their fears, their concerns, stuff, as we should. It's just human nature. But I question the council, if there is 5, that we're like, all right, we're just going to extend it. And then another month, we have 2. All right, we're going to extend it again. I guess just more for everybody to think about, as it's such a minimal, such a small amount, we're all aware. The concern is that we're not targeting it enough. Like, all right, where was that person at? Obviously, they go through the steps. As people don't know, I traveled all over the country. I came back, and it was a concern that I possibly could have it. And so I went through all the procedure and stuff, and it was a mess. There was just no structure, and this was right at the very beginning of it. And now everyone's aware. Everybody's cognitive, like, hey, what's going on? Where did this happen? But there's not that open discussion like, hey, where did the person work? What did they do? Just so we're all aware. Just having some little bit of openness in regards to that. And then the last one is, my last question. So the exchanges of Brookings is going to be coming up here really soon. And as rental community, I'm a landlord here in town. At the end of May, most of the leases are up. So a lot of college students that people aren't aware are going to be coming back to our town. And it is a viable thought. They're coming from all over to clean their house out, take their stuff out. They're probably at home. So it's something that, as a city, maybe we consider it or think about it or have something to, I guess, process. I'd like to just go back to our full normal, as we should, because our cases are so small. But it was just the last point that it's something as a city we have a relative situation that could potentially be a situation or not. Yeah. Thank you for your time.
Very good
Appreciate
point. So I think Paul had a comment.
Yeah, I would just comment on the cases. A lot of the public assume that the city knows all the details of of the cases here in the community, and that's not the case. Usually what happens is the state will investigate it, identify those people, identify the people that they need to communicate with, but for the most part, the city's left in the dark. And so a lot of times I rely on the newspaper or other individuals to help me understand what's going on, but we are not in direct contact with the state, and the governor herself has said that she will not communicate that information to people because she has to communicate that information with individuals first and foremost, and there's a process there in place. So I just wanted to clarify it in case the other people watching at home think that we are aware of all these individuals, their names, where they're living. That's not the case.
I think Department of Health is getting tired of me calling all the time saying, when are you going to let us know all this? But good questions, Kevin, and a lot of those I've gotten from other people, so I appreciate you bringing those forward. So, anyone else care to speak to the council? Sir?
My name's Josh Barber. From here in Brookings, lived here for 11 years. I'd leave my mask on, but I can't talk with it on. So I run the risk of possibly offending multiple people by my statement. I tend to ramble, so I wrote it instead of trying to recite it from memory. I want to address the slippery slope that our great city of Brookings is toying with by reading this ordinance for the first time. I love living in Brookings. I've lived here for a long time and truly appreciate the people here. I've always felt that as a city we've made good decisions, always in favor of our community and the people in it. The slope I'm talking about is infringing on our constitutional rights and freedoms out of fear. This is a precedent I do not believe is worth setting. Our rights are what make people want to come to our great country and in turn want to come to our community. In Section 5, subsection B, the term necessary is used. To me, that's a scary word in an ordinance like this. Who makes that determination? What if I deem necessary that potting plants or flowers or potting soil for a garden is necessary? What if my wife deems that picking up the trim for our bathroom at Lowe's is necessary because I finally have time to install it? Are you going to tell me or my wife that that's not necessary? I understand there's a lot of lists and there's 8 pages of documentation, but it's still left fairly wide open. South Dakota is the new hotspot. More realistic is that the new target, that it's the new target because our governor is standing up to the powers that be. As of 11 o'clock this morning, I ran the numbers just like every Monday. Being someone that could potentially be of high risk, I decide whether it's the right thing to do the job that I do. We're a 0.08% infected state. Brookings County is a 0.008% infected. Do you realize that you have a 20% chance still today of getting the flu, or a 30% or a 0.3% chance? So you can do the math. It's like quite a bit of getting the E. coli virus just by eating, or the E. coli disease just by eating. Part of the big picture, even in our hospitals here in South Dakota, friends of mine, our doctors, nurses, are being laid off on a daily basis because there isn't enough work for them. It's time for the communities to stand up with our governor for our Constitution and our constitutional rights. Quit following the herd. Our state is currently being chastised for being a leader, and that's okay, because nothing good ever comes easy. Has anyone looked into the ramifications of suspending my constitutional rights and my fellow Americans' constitutional rights and freedoms without a constitutional amendment or an act of Congress or anything else? Are we considering this because everyone else is doing it? I urge you to delay the initial reading of this ordinance for 1 week or more to do more investigating, support our local businessmen and women, and our local economy. Those are the people that helped build this town into what it is today. I again urge you to be followers, or not be followers, be leaders in this crazy time. People have given their lives to protect those rights I'm referring to previously, and we are willing to give them up out of fear. I'm betting that the men and women that have defended those rights were scared from time to time. But they saw the mission, and currently we still live in a free country, kinda. Thank you.
Thank you, Josh.
Just real quick on the new Granicus tool that we have, just like any technology, you run into hiccups. So those people that are watching at home or want to continue to submit things, on the back end, we're still receiving things, but just to make sure, feel free to submit those comments to the city council at the cityofbrookings.org website, or Bonnie Foster at cityofbrookings.org. That's BONNIEFOSTER at cityofbrookings.org until we get it up and going. So we'll try to work on that. You can see the clerk diligently working on that throughout this process. So just wanted to make that comment to the people watching at home.
Thank you. Anyone else care to speak to possible first reading?
Hello again.
Hello?
Bradley Walker, 434 Finch Circle here in Brookings. I am just here to voice my opposition to this ordinance and any other future ordinance that limits our rights to conduct our lives in a basic, normal manner. I should have made notes because I'm going to be bouncing all over the place. I agree with a lot of the stuff that this previous gentleman said. The thing about the way that these numbers are being presented, where there is cases and then there's recovered, I believe they should be listed as active cases only, whereas you have a number of how many are actually active cases. And then the other thing is, how many of these active cases, there have been 9 so far, actually required hospitalization? I don't have an answer to that. I'm assuming it's 0, but I don't know. But like I was saying, and the sticking point that you keep pushing, I guess, or using, is you want to flatten the curve. There's a lot of catchphrases going around: flatten the curve, slow the spread. I agree with social distancing and all that stuff. That's fine. But the other thing, catchphrase that nobody is saying, is the cure can't be worse than the disease. And we're getting to the point where this is just keep going on and on and on. So, excuse me, back to the numbers again. So if there was 9 cases and 6 had recovered, to me that means that there was a point in time where there was no active cases in Brookings. I'm speculating again. I have no proof of that. But the way that there was a point in time where there was 6 cases and 6 recovered. So to me that means there was no active cases in Brookings. And so, again, this small businesses not being allowed to operate, hair salons, gyms, barbershops, they can do all that by appointment only. And if they choose not to interact with customers, then that's their choice. But I don't believe that you people should determine that. That should be their choice on their own. Like I said, I mentioned before, the governor has suggested abiding by the CDC guidelines. And it seems like you have gone one step further in doing that. And then the other thing I saw was that the Brookings Health Department said that they were expecting the peak of the virus to be end of May, mid-June. So are we going to just keep going until then with no regard, or could we stop now, and then if it does pick up when the peak is going to hit, reenact the ordinance 2000 or 005? And again, that projection, as I understood it, was for the state of South Dakota. And I don't know if they have a projection for Brookings County separately from that estimate. Like, when is our peak going to end or hit its peak, and the duration of that? So there's probably a bunch of other stuff. I'm sorry, I should have made notes. But again, I just oppose this ordinance about. I think that the ordinance that you have now is this ordinance 2006, which is just redundant. I mean, you've made pretty strict guidelines on 005 about what can and can't be done, and this is just redundancy on top of it. Now, if for some reason there needs to be more, if something boom hits and we have, okay, I'm sorry. I just remembered another thing. I was doing some research online, and I came across a plan from 2014 about Be Ready Brookings. I don't know if you're familiar with that. And I was looking through, it was a whole pandemic plan, very detailed, and it had different stages of the pandemic. And on none of those, I might have missed it, I don't know, none of those suggestions about what to do when that pandemic, at that stage of the pandemic, mentioned anything about closing down small businesses. The number one suggestion on every single stage was isolating the cases, the infected cases. So, and I'm not sure, what I think you're doing is you're doing it backwards. You're isolating the people who aren't infected to prevent them from being affected, when the only people that should be quarantined or be isolated are the people who are actually infected with the disease until they are treated and found to have no other symptoms, and then they can be able to go back in the community and not have any restrictions on what they can do, what is essential, what is not. Okay, I think I'm done.
Okay.
Thank you for your time.
No.
And I'm sorry about the rambling.
That's-
Thank you again. Oh, one more thing, sorry. I would like to make a suggestion that you reassess 005 before the May 6th, the next May 6th deadline, when you're going to either reenact it or can't table it or cancel it or whatever you want to call it. Because like I said, if there's only 3 active cases now, they're going to go away. Hopefully, there will be a point in time where there will be 0 active cases again, like there was last week when there was reporting 6 cases and 6 had recovered. Thank you.
Thanks, Bradley. Anyone else care to speak to first reading?
Thank you very much. Isaiah Crevier, Champion Health, 4305 Fifth Street, Brookings, South Dakota. So, number one, thank you so much for your guys' service here in Brookings. I realize that the situation you guys are put in is a very stressful situation. And just with the stuff that's going on social media, there's a lot of people that are coming out and saying different things, and we're hearing both sides. Number one, I would like to know City Council's response to the gentleman in the back.
Are you asking about the question of?
Yes, this gentleman, he asked the question in his speech, and I would just like to, I wanted to hear a response to that. So,
which question?
Would you reiterate your question, sir?
The constitutional.
I apologize. Would you reiterate your question in the way that you wrote it? Well, there was definitely one in regards of constitutional rights. Would you like me to paraphrase? Go ahead. Okay. Sounds good. I believe it was in relationship to the constitutional rights of American citizens with the shelter stay-at-home order. You're actually having citizens not being free to roam about, to do those things, what is the council members' opinion on such a place infringing on constitutional rights? We haven't had a lot of clarity on that in regards of from the governor's place. They haven't put that in place, and yet you guys are putting that in place potentially here. And I would like to know the city council's opinion on that.
Yeah, I can start with that.
Yeah.
That is a problem for me. I honestly struggle with that quite a lot. I do appreciate the slippery slope argument, and
Yes.
I think that as we are weighing out our options here, one of the things that's really true, and there's a lot of uncertainty with all of the numbers, all of the projections, all of the trends, all of those things are uncertain. But if you focus on public health at the expense of economic health or civil liberties, that's a problem. If you focus on civil liberties only at the expense of public health and economic health, that's a problem. And you see where I'm going with this.
Correct.
If we make a decision in one area, it's pulling a lever and it's putting the hurt somewhere else, to put it bluntly. And it's definitely not something I take lightly. I look at what else is happening in South Dakota. No other community has put something like this into place at this point in time. Our governor is not going in that direction. And believe me, I understand why people are asking for that. But in my opinion, I think this comes down to a question of two ordinances that are substantially very similar. They're not going to change day-to-day activities of many of us in many substantial ways. What we're doing instead is just thinking about how do you feel safe as an individual. Now, some people are going to say, I don't feel safe unless the government tells me what I can and can't do. And some people are going to be on the opposite end of that spectrum. And so I'm trying to figure out what this community wants and what the majority of the people think about that. I can tell you just in the last week in the city council email account that we all have access to, there have been over 50 emails that have come to the group of 7 of us. And 40 some of those were highly opposed to this, and 10 or 11, 12, somewhere in that neighborhood were in favor of this. So that's one thing that I'm looking at as I weigh these things out.
Gotcha.
Thank you for that.
I would like to hear from other city council members as well.
This is Holly, and I'd be happy to respond to this as well.
Thank you, Holly.
I would echo a lot of the sentiments that Councilmember Brink has just brought up. It is a concern for me, knowing that an ordinance that we may pass and other ordinances that we've already passed have infringed upon especially the economic rights of certain individuals. However, as Councilmember Brink stated, this is about a balance between economic health and the well-being of people's actual lives in a lot of ways here. And so there is no right or wrong answer, and unfortunately there's no handbook that they give you in terms of how to handle a pandemic situation. What I do know is that Governor Noem has requested that local communities address this head on rather than providing a statewide closure. She has requested that local governments make the decisions that are right for their own communities. And as Leah stated, we have had a lot of comments come our way. I would say that I have been taking a tally of the number of comments I have heard as well, and my tally actually differs from Leah's in that the number of people for this ordinance and those against this ordinance who have reached out to me are actually completely equal, down to the very number. I have had an equal number of people saying they are for this ordinance and against this ordinance. So that tells me there's a lot of folks out there that are torn. Our community is torn as to what the right response is to this. And so I feel it's our duty as a council to put ourselves in a position where we are prepared to answer in the case of an extreme circumstance where we may need to protect the lives of individuals within Brookings.
Thank you, and I agree with your statement on protecting the lives. And forgive me, I addressed you as Holly before. It's Councilwoman Byrne. So sorry about that, Holly. I mean Councilwoman Byrne. In regards to the other council members, would anyone like to speak on that as well?
This is Patty, and once again, I think both Councilmember Brink and Tilton Byrne have articulated the struggles we're going through as a council, looking at all of this. From a legal perspective, and I'm hoping that Steve can respond to this. I believe that. Sorry, my puppy decided to weigh in on this. That we look at. I think the emergency clause is what triggers our ability to do this, but I can't. That's why I'm going to ask Steve to comment on this when I'm done. But know that we're not doing it because we have any desire to infringe on anyone's civil liberties. That's not our goal. My experience has been about 50-50. I didn't tally to the number, but I did keep track of. We've had dozens and dozens of emails, which I'm thrilled. I'm glad that folks are speaking out on this. But it's been interesting. I've had more businesses respond saying thank you, and please keep this in place. So, there's both sides to this issue. But Steve, could you help us out of this dilemma to talk about our legal ability to do this?
Well, I think there are different opinions about the severity of the problem. Some people might think it's not as severe here in South Dakota as maybe in New York or on the East Coast, but
For sure.
But the medical community, I think, has expressed some concern about suppressing this particular disease, and have provided us guidance as to how to do that. And so suppressing disease is a power that municipalities have.
Mm-hmm.
I know that point has been debated to some degree, but if the city takes reasonable measures to...
Excuse me, forgive me for cutting you off, but when you say it's been debated at a different degree, is it a gray line or is it black and white? So do you have the right or do you not have the right? Because the question was constitutional. So I'm trying to put the pressure on what is the actual city council's opinion on the matter. Do you have the right or do you not have the right?
The South Dakota Supreme Court has ruled that a city council has the authority to take reasonable steps to suppress disease.
Gotcha.
And so, while that's a fairly just basic concept.
It's a vague term, correct?
Well, I wouldn't say it's vague. It appears almost verbatim as I've stated it in a South Dakota Supreme Court opinion. But the point is that there certainly are always going to be differences of opinion as to how significant an emergency is, how significant the risk is to the public. But governing bodies are authorized specifically under state law to determine what's necessary to address a disease and take reasonable measures. They have to be reasonable to address it. And that might include temporary restrictions or limitations on the constitutional right to associate and to have the freedom of travel and some of those things, which people believe are, and which is true, they're constitutional rights to do those things. But temporarily, when it's necessary to suppress disease, a governing body, in my opinion, based on state statutes and the Supreme Court of South Dakota, would have the right to limit some of those free exercise of those constitutional rights.
Okay. So one thing about being in the health sector, there's a lot of, obviously people staying at home. Well, when we look at houses, how they're built, what's in them, paint, all of that, we know that being inside is actually worse for people than being outdoors. A shelter in home does not provide us being able to go out and be in the parks, right? We're not able to be at those things. Now, I noticed there's a lot of playgrounds that are choked off. You can't even participate on them, which is unfortunate as I have 3 kids, right? Us getting outdoors is actually better for our health. So why are we taking drastic measures which actually may make us less healthy than something that actually might help us? I understand the whole 10. I get that, right? But at the same time, we're also not allowing people to move freely, which in my opinion would be a violation of our constitutional right, which that's what I do not want to see happen here in Brookings.
If I can, real quick, just to clarify, so the people at home know this, Because you made a point real quick that people can't leave their homes. That's not, in fact, true with this ordinance or the existing ordinance. People are allowed to go outside. In fact, we strongly encourage people to go outside, utilize the park, utilize the trails, because it's going to get nice out. I mean, we've been waiting,
Right.
9 months for this?
Yes.
So it's a great opportunity for people to get out. We're just asking that people continue to social distance, keep within 6 feet, because we have received a lot of calls, a lot of emails, people assuming that a stay-at-home ordinance is just that you have to stay at home. And that's true, but
Well-
for essential services.
Right.
And part of those essential services are going out for peace of mind, for health and well-being. And so you can go out and walk Fido. You can go out on walks with your family. You can go out and enjoy the parks. Yeah, there's certain things that we've taken down to reduce and minimize the risk. But I just wanted to clarify that for people at home.
I understand that, but at the same time, when you read it, it's stay at home. And so your average person who's not listening in on this meeting, your average business that didn't read the ordinance but just assumed, they're going to make those things. And there were probably businesses that closed down because they thought they were a part of it, and they didn't know if there was any ways around it. And you got your, I would say, your more entrepreneurial businesses that are like, yes, the ordinance says this, but I'm going to do this, and this allows me to actually benefit, to continued benefit. You look at coffee shops that are doing takeout. You got businesses that are restaurants that are doing takeout. But we've seen a lot of other businesses that close that are less busy, but yet they're still closed because they thought they were a part of it. So the communication is more of like the impression of the ordinance. So even though it says, like in the specifics, that yes, you can go out for walks and do those things, when there's a stay at home, I'm hearing from clients of mine, I'm hearing from fellow businesses, it really is, people are staying in their homes. They're not leaving. They're not going on walks. They're not going to the park because they think that everything's closed. And when you look at some place like Walmart, and forgive me for picking on Walmart and Hy-Vee and Lowe's, because I've been to all those places, but a gym, which is, number one, thank you very much for speaking out in the last couple meetings, the gyms that are going to be washing the dumbbells and cleaning and sanitizing like crazy, they are actually the ones that should probably have more of a right to be open than a place like Walmart where someone's going to pick up a thing of diapers, not want it, go put it back, and somebody else is touching it. Not to mention the amount of people that are walking through the doors and such. I'm all for freedom, and I want to see the people of Brookings have that freedom, and so I want Walmart to stay open. I want Lowe's to stay open. As an essential business, I don't need to be here right now. But I'm here because there's a lot of other businesses that are voicing their opinions. I would agree with the council members stating that it's 50-50. Some businesses are happy that their businesses are closed down so that they do not have to make that tough decision, especially because most people would not be entering their business, period. Right? So if my business went down to zero, there's no reason for me to be there anyway. So in some aspect, there's people who didn't have the business, so they just closed up shop anyway. But I am all for freedom, and when we see that freedom infringed upon, and when you say stay at home, that's what your average person is thinking, so they are actually staying at home. So even the current ordinance as it is right now, people are staying at home. We're seeing a vast decrease in the amount of people on 6th Street, on 22nd, on these avenues. A lot of people are staying at home. We're seeing more people out walking now, which is awesome, walking their dogs because they're not traveling, which is great, but at the same time, we still know that over 80 to 90% of people are still in their homes, right? Okay.
To that point, I think it's interesting too, you'd have to be thinking of your story about what essential function you're going to be performing as you leave your house, because you want to make sure that if you're stopped and questioned about that, then you have something justifiable to say.
Correct.
And I would say to your point too about healthcare, I think it's interesting that we're stating specifically that gyms are not part of healthcare, when I would argue that there is a lot of health components in relation to people's physical health that also relates to their mental and emotional well-being.
Right.
And we're taking that away from people right now. And I've heard from a lot of people that are very concerned about mental health at a time like this as well. Yeah. And for some, going to that gym is their outlet, is that thing that helps them. So that's a concern that I share as well.
So even if it was 50-50, emails being received for or against, why are we not just not doing anything? Why do we have to make a decision that's going to go in the affirmative of putting a law in place? To whereas if you are basing your decisions off of, well, 50% of people say this and 50% of people say this. I know you're looking at health data too, but if you're looking at what the public opinion is, why are we not just not doing anything if we're just taking the public's opinion on it?
Okay. All right.
Well, that was a question. So why are we, if we're listening to what people are saying, and we got, because you guys brought up that it was 50-50, right?
Not what I heard, but
Well, you said 40-10. I'm going with the numbers that were more pleasing to the ordinance, yes. But if it is that, why are we not doing anything at this point? Because right now, the status is we don't need a stay-at-home in place, correct?
I mean, I don't have an answer for everyone else. This wasn't my idea to bring to the table tonight.
I would like to speak to transparency, and this will be the last thing I'll say. When I'm hearing the numbers in the back, where you guys are saying, yes, it's based on this, based on this, based on this, I do not think that that is acceptable. And as a citizen of Brookings County, citizen of Brookings City, that does not fly for me as a person who has elected people. And as an elected officials, you should listen to the public as well as take into consideration what other health providers are saying. And if there is something that does come up in regards to, COVID-19 being as bad as they say here in Brookings County, you do need to have the transparency to talk to us, the people, about it, because it does affect us on an economic side, it affects us personally, and it definitely affects the public health. So it would be my recommendation that we do not proceed forward with this, and I would appreciate if everyone would take into consideration that some of us, as those of us who are leaning more constitutionally, that is going to come very hard as a person. If you're asking us to stay at home, do we want to do it because you've asked us to, or do we want to do it because you've told us to, or do we not want to do it because you've told us to? So if you are going to infringe on our constitutional right, there may be people that do not abide by that because it might be unconstitutional. So we would need a good explanation for why that is. So if you are going to take into consideration the public health numbers, we would need to know that. So if cases for some reason spiked, let me know. I would love to stay at home. I want to do that. But I do not think it would be fair to the people of Brookings is if you just make a decision based on arbitrary numbers and executive sessions. Thank you very much.
Okay, thank you. Anyone else?
This is Holly, and I'd like to respond a little bit to that since there was a request to respond to it. I would say that in part the reason why we are even moving forward with this is to prepare ourselves. I think that if we were to not have these conversations, I think that would be a lack of responsibility on our part as elected officials. I know that a big reason why I wanted to bring this conversation to a first reading is so we could host this very conversation that we're having right now, so that we as council can be transparent with the community and explaining why we are thinking certain ways that we are and what the comments are that we are hearing. And so I would hope that this very conversation and the fact that we are bringing language forward now at this time shows that we are trying to be very transparent in this process, and we're explaining now who we're talking with, who in the medical community we're talking with. I can tell you from my own personal viewpoint, I am reading every single comment. I am taking every single phone call. I am trying to get as much public input as I possibly can, and pairing that public input along with the guidance of our medical community, the CDC, and other experts. I can only go on that information to make the best educated decision that I can as an elected official, and still feel comfortable with myself knowing that I am doing what I consciously believe is the best step for our community. And so I want to take this opportunity to thank everybody who has submitted comments, because I am taking each and every one of those comments very seriously. And it is because of many of those comments that I had a desire to bring this conversation to the forefront today, so that we can start having this public dialogue and be prepared if the event arises that we are in a very serious situation.
Thank you, Councilmember Byrne. The reason why I came back to the podium was because I came to the city council meeting the first time it was passed, and there was three gentlemen, the gentleman sitting over here, he had spoken again then, and two other people spoke, and you still passed it. And then last meeting I was here, I believe 4 people spoke, Simon Newkirk brought up some good questions. We also had a person, you spoke as well, and you listened, you asked a couple questions, you gave eloquent responses to Simon Newkirk, but not specifics. And then you still made the decision. And so from the appearance side, it doesn't really seem like our comments are actually being heard. And I'm not trying to be abrasive when I'm standing up here. I'm just trying to get answers because there's a lot of people that have spoken to me. There's a lot of people that have spoken to other people in Brookings where we do not feel like our voices are heard at this point. So you say you're reading comments, you're listening to people who are here, but yet your decisions don't reflect that. I mean, we had a unanimous decision when the 3 people that actually spoke here at the public forum were opposed to it. So I just had to state that, yes, I understand that you say that, but it doesn't seem like you guys are actually taking into consideration the public.
So
Okay.
this is Holly again, and the only comment I would say to that is at this time when so many people are practicing social distancing, many of the comments that I've been receiving have not been those in the chambers. It's been others that are done by phone call or by email, and there's been a lot of conversation that way because people are very cognizant of practicing social distancing and are limiting themselves from even attending the council meetings. And so I do think that that may impact the visual of what it seems, at least from my perspective in the comments I've been hearing, the number of comments that we've heard on either side. I would also just say that participating in a meeting such as this via call-in versus being in the room, especially when so many of us are calling in and not in the room, has been a significant curve for us. And I can honestly tell you that during the last couple of meetings, I've been honestly learning how to jump in and provide comments because there is a little bit of a lag and a delay, and I'm not trying to make any excuses at all. I'm just trying to explain there has been a learning curve when it comes to figuring out how to participate remotely when so many of us are called in versus being in the room.
Correct. However, making a decision, I agree with your statement, but making a decision like this still bears the same amount of weight and respect for the public as it did prior to COVID-19. And so saying that it's just due to technology, us not being there, still passing it, you still have to have the same amount of freedoms pre that you do post. So I understand that there are difficulties, but then you should also make considerations for those changes technological wise. One other comment. I really appreciated what the city manager spoke about in regards to reopening the liquor store and how you could properly do that. The golf place as well. You figured out ways that you could eliminate as much contact. And I personally didn't shop at the liquor store, but I heard that you guys had a table outside and people were going in and out, employees only though, so that people weren't inside touching everything, correct? Okay, that was absolutely fantastic. And I think that the city actually showed a lot of entrepreneurial spirit in that. I would like to see the gyms, the salon, the spas, and the people have the same freedom of practicing their social distancing, opening up their business, finding ways that they can be creative to get their economics back at the same time while we're protecting ourselves too, because I think the city just made a great example of how a business can shut down, reopen, and reopen in a proper way that is more safe, more effective with the status that we have right now, and we don't have to put that closure restriction on them anymore. So I think the city did a good example of what the people of Brookings can do, and I would like the city council to actually take into consideration of potentially having that freedom back to open their stores for takeout shopping for furniture, because Lowe's is not essential. I'm just going to say it. Maybe for some contractors, maybe for myself because I'm expanding my business, but it is not essential for health like food is, right? So thank you very much for your time. I appreciate the patience that you guys have with me, and thank you very much for serving. I do understand that this is a really big decision, but also understand, too, it's a big decision for us, right? And if you strip that decision away from us, it's just not going to be as nice for those of us who are very constitutional. Thank you very much.
Okay, I'll close the public comment at this. Oh. Sir, in back, did you want to speak? You did like to address this subject? Oh, please, come forward then. I'm sorry. State your name and address, please, and
Ryan Beasley, 1006 15th Street South. I'm just curious, I know this, I'm not trying to be disrespectful in any which way, but I'd be really curious to know why we're going down this ordinance. Can I just have someone explain it to me again? Why we're taking this to another level?
Yeah, I could sure comment on it. The intention of tonight is not to enact it. The intention for tonight is to hear the first reading, and I assume the council will probably table it. And so therefore, in the future, when we do hit that threshold, whatever that might be, that we'll have it in place. Because if we wait until that time to have the first reading, and say we hit that threshold, we need to act fast, we would really like to have, the ordinance would really take another 5 days before you have the second hearing. That 5 days can mean many more infections across the community. So the intent for tonight is to have that first hearing, vote on it, and then table it so that if and when we ever need that, council could go ahead and act upon it. The hope is we never do, right? The hope is that eventually we all get back to normal. I think all of us want that. But the intention for tonight is that if council should need it, they have it at their disposal.
Okay. Well, obviously you know where I work. I mean, I'm a walking billboard at the moment. I deliver food for restaurants, hospitals, and nursing homes. I go to Huron. I live here in town, but my company is based out of Fargo, but I work here, resident here for 7 years, 8 years almost. And I go to Huron, I go to Pierre, I go to Watertown, I go to Millbank, I go to Canby, I go to all these places. And the reason why I'm all stretched out now is because my company's had to furlough 30% of their workforce because restaurants have basically shuttered and closed. And it's down to carry out and delivery only. Well, if you're not pizza, it makes it really difficult. A lot of these companies or businesses are literally struggling hard. They've laid off all their employees, basically just management is only working right now. And I'm watching these people lose their livelihoods, especially in Huron because they did the whole lockdown fairly early because Beetle County was a hot spot there for a while. But they haven't had a new case in quite a while, and it basically came from that one family. So I guess the issue that I really have with this ordinance is that I just think it's going too far. I think we're already there now without an ordinance. I guess the idea of having government tell me that I have to stay home is getting to the point of what else are you going to do to me? You know, I think we've reached the limit now where enough's enough, and I'm not trying to be disrespectful to anybody here, okay? So don't get me wrong, I'm just venting because of my frustration. I mean, there was a 2-week period of time there where I was down to less than 20 hours a week. I had to file unemployment there just because I was scared I was going to lose my job. I'm normally working 50, 55 hours a week and have been doing that for almost 6 years. And I was watching my livelihood go down the tank, literally, in just a matter of weeks. And what my understanding was is that this was going to be short-lived, but now it just keeps getting longer, drug out longer. I understand that maybe a shelter in place should be in Sioux Falls at the moment. I mean, that place it's a hot spot, granted, but the majority of those cases are coming out of one pork plant. It's not being spread throughout the whole city considering that it's almost, 200,000 people? So I think that the lockdown on certain people, we have, 3 active cases in town? Are they quarantined? Nobody knows?
I don't think we know the answer.
We
to
don't know that
That's right,
answer.
Paul.
Yeah, the state doesn't tell us that information on individuals, who they are, what they're doing with them.
Because as it says on their website, 9 infected, 6 recovered, which means 3, I'm assuming?
3 that they've tested, yeah.
So does that mean 3 that are active within the county? Is that what that means?
That's what we
Yeah.
assume through that information.
This is Patty, and I don't think it means that. I think it means that in addition to those that are now in recovery, there are that 9 active cases. But as Paul said, we don't get any information on any specifics. We don't know if it's community spread. We're getting a little more of that information as the numbers grow, and as Bonnie Sprecker's information shared. So we don't know any more than you do when it comes to the specifics on these cases.
Yeah, I would just clarify that we do know that of those cases, those 6 that are resolved are no longer have fever, and that's kind of the threshold that they have. They no longer have fever. I think it's for 48 hours, and so they're not systematic. So the 3 that we do have, we assume are active, but that's all further we know.
Do we even know they're in town?
We don't, sir.
So why are we doing this? Why are we punishing people? There's a lot of unknowns you just all said here, and we're going to punish everybody, and we don't even know. See what my point is? Seems a little dictative, don't you think? I mean, if we don't know, then why are we doing it? Is what I'd like to know. I mean, in Sioux Falls, that's pretty clear. They know exactly what's going on. But and they haven't taken this drastic step yet. I know that Tim Aiken has asked the city council to address it today. The governor's refused. So if the governor's refusing, then why aren't we following her lead? I mean, she's following CDC. Isn't that the gold standard? And so basically, that's what I think we're going too far. I mean, what would you consider? I'm putting myself out there in the public because I have to deliver to all these places. I'm not a big fan of it at the moment, but my company's given me rubber gloves. They've given me disinfectant wipes. They've given me masks now because there are certain customers I have to go do that. I get my temperature checked 6 to 8 times a day because I deliver to hospitals and nursing homes. And then I was in Clear Lake at a nursing home with Good Samaritan, and they were having visitation. You know what that visitation was? They were wheeling the residents of that nursing home to the window, and their family was coming to the window, and that's how they were visiting. I'm not even allowed in the building. I have to hand my 2-wheel cart of food to another guy. He takes it in and delivers it, brings my cart back. I go back to my truck, fill it back up, bring it back. Nobody's allowed in the building. Now, I understand they're high risk. I get that. But it's sad to watch. It really is sad to watch. And what I'm saying is when is this going to stop? I think that as the governor said earlier today in an interview, it comes down to self-responsibility. If you're that fearful, I shouldn't even use that word. If you don't want the virus, then stay home. Put yourself in that position to do that and be self-responsible for that. But if there's other people that want to have a livelihood, then let those people have a livelihood, because their livelihoods are literally getting destroyed. I'm sitting here watching and it just makes me sick. Because I'm not sure when this is all done and over with, what kind of job I'm going to go back to. Right now, I'm surviving because hospitals and nursing homes are taking in large amounts of food because they're not allowed to bring in outside food. But at the same time, I'm watching some of the biggest restaurants in this town, and I mean, their orders are just, they've plummeted. They're down to 80% of what they used to do, and they're just barely keeping their head above water. And I think if we take any further restrictions, all it's basically going to do is choke off whatever's left. And I don't think that's right. And it shouldn't be up to the city to decide that. It should be up to the citizens to decide what they want to do and where they want to put themselves at risk. Now, I hear the flatten the curve and all this, and we don't even have a pimple in Brookings at the moment. There is no spread. I understand that we want to have the action put on the shelf, but the idea that it's even there and can be triggered at any time is rather disheartening to me, that government would go that far to put its citizens in a position where they have to be boarded up at home. I think Brookings already is pretty much essential only at this moment. And to be honest with you, if we go any further, it's just further pain and suffering on people that shouldn't have to be. That's all I got.
Thank you. Anyone else care to speak to this? Okay. Introduce yourself and.
So sad that I can't see your faces. We're having to be extra expressive with our eyes, aren't we? My name is Elizabeth Waka, and my husband and I own a business here in town, and I'm also a special education and behavioral tech teacher at the Brookings School District. So, my first question to you is, are any of you qualified medical professionals specializing in health, public health, epidemiology, or disease control? I'm asking you that question. Can you answer, or am I just giving a spiel here?
Oh.
I'm not.
This is Patty. I'll respond. No, we aren't, but if you were listening earlier, that's why we've reached out to every one of those professionals that you just mentioned.
Perfect. I'm
That's
glad.
whose
Yes,
advice we are
perfect.
getting.
So have you provided the citizens of Brookings with a list of those professionals? Is there a list of doctors and like in Brookings, in the county, in the state, local, national level that you're consulting with on a regular basis that we could access on the website?
One of the things that the chamber and I are working on is hopefully by the end of this week, maybe early next week, to have kind of a forum for those professionals to come out and speak to the community. So you can ask probably questions that you maybe you'll be asking tonight. A lot of the questions that were asked tonight are of those professions that could provide that information.
Right, and that, I mean, especially now, always, but especially now, it's incumbent upon you guys. If I were in your place, I would want to provide my citizens with every single modicum of information I could give them. I would want it all to be transparent. I would want for my citizens to be able to go online and say, these are the medical professionals, these are the doctors and the specialists that my city council and my city leadership are looking to for answers. Because as we know, if we're not qualified to make statements about that, we should not be speaking to that. We should first and foremost refer to professionals that can make the best decisions for us, and I do appreciate that. So I will be looking for that. I will be looking for that. So.
I do remember that there were about 3 editorials written by local medical doctors from Brookings Clinic that were published in the Brookings Register.
Which is great, and I think that shows their level of concern, obviously. That was their choice, however, and I obviously would hope that they would continue to do it. That's amazing. However, what I'm asking for from you, and I think that I can speak for every citizen in Brookings, is I'm looking for your leadership in this exceptional time. This is a special meeting. Are you guys cognizant of the fact that each one of your votes counts for over 3,400 people in this city? And it definitely, I mean, we can't possibly know, ever. Doesn't matter how simple the decision is or how complex it is, how life-threatening it might be. We can never possibly understand unintended consequences or any of those things. We have to make the best choice that we can with the information that we have. So it's really critical that we have data and facts, right? We can't just let our guts, we can't just say, I think, or I'm not sure. I've only been sitting in this room for 15 minutes, and I've heard, I don't think, I assume, we're not certain, we don't know. That causes me a tremendous degree of stress and anxiety. And I'm a very logical person. I'm a very rational person. You have been given
Elizabeth, could I?
Of course, yes.
Could I respond to something? This is Patty again. Just so you know, hopefully, you said you've only been here a few minutes. We are not voting on anything tonight. That's not what we're doing.
Correct, yes.
Opening up, as Holly said, we're thrilled. We want this input along with the dozens of emails and phone calls that we've gotten from citizens, but we're not making a decision tonight. Without
yes, I'm not concerned about that.
We wouldn't have had an opportunity to invite this comment.
Yes, of course. Yes, thank you. So yeah, I would like to see the names of the doctors. I mean, I think that those steps, those common sense, rational steps, is the only thing that's going to counteract that fear, in my estimation. I look for facts. That calms me down, makes me feel better. I don't know about anybody else. So names, who is advising you? What is their position? How long have they been in our community? How are we connected with them? What data are they giving us? How often are they reaching out to us, or are we reaching out to them? What does the data say that they're giving us? Who's helping you correctly interpret the data? because you have been given, the fact that you guys are able to make the decision as to whether your citizens, all of us, need to stay home is probably one of the best examples of why local government is so important. Is that you have been given authority to make the best decision that you can for a city that you live in. Nobody else is going to tell you. That's what's awesome. That is what needs to happen with local government. Because right now, you need to make the best choice you can for your citizens and for yourself and for your families. If you don't, I just would like to understand who is not providing you with this information. If you're saying, I don't know, I'm not sure, they're not telling us, how does that help me trust your decision making? How does that help me trust you?
Liz, could I answer that
Yes.
point for a second? I think the reality is, many have said it, this is an unprecedented situation,
Yes.
and a lot of people don't know. That's one of the things that makes it very challenging for anybody in this position to make these decisions. Even the medical community doesn't agree completely on the steps that should be taken and what should happen. I know people that have said things on a whole wide spectrum that are representing healthcare. And so, we can make some educated collections
absolutely.
of that information.
Yep.
The other thing I would just say too is that we all are aware the intention is to table this tonight, but obviously we can't get to a passage without doing a first reading. So this is still a first step in a process.
Yes. So maybe this is my whole thing doesn't need to, do I just need to say we need to be very careful when we make a decision like this? I guess, if there are things, I hope that you guys go back over the minutes. I'm sure that you will. And if people have questions, you're going to look those up. You're going to get answers for us. I just know for my children at the school, we have hundreds of children and families that rely on school meals. Most of our kids that qualify for free and reduced meals will have 2 meals a day at the school. And we do have a backpacks program that provides a meal for them to take home for the weekend. And believe me, it's not even enough for the child that takes it home. So these children and their families are facing the reality of going without food if something like this is implemented. And if it is implemented, how will it be implemented? Who decides who gets to go and make food deliveries? Who decides who's being honest about where they're going and what they're doing? It's not just going to be a blanket stay at home, right? We would need an outline of what it's going to look like, because there are children that will literally be starving if this is enacted. And I'm not saying that it's not the right thing to do. I'm just saying that there are, and you guys were discussing how many emails you've gotten for and against. I'm like, I certainly hope that we aren't looking at this shelter-in-place pros and cons, and I'm for it and you're against it as some sort of popularity contest or the majority rules or likes on Instagram. That's not what this is. I guess we're going to continue to have questions, but I implore you, as our city leadership, and haven't been given the authority from the state constitution and the national constitution to do your job, I implore you to make sure that you are extremely transparent, you update your information, you give us all the information that we need to know. And for the record, I do believe that this is the government overstepping. Unless you can prove to me with data, factual data from a professional, I do believe that this is overstepping and is not appropriate. So thanks.
Thank you.
I think, correct me
Mayor
if I'm
Corbett,
wrong,
can I
though,
make
but,
a quick comment?
oh yeah, were you going to talk about the food delivery?
Yes, please.
This is Nick. Can I make a quick comment in response to
Yes.
Elizabeth's comment?
Yes, please, Nick.
I just think it's important because we're in a public forum that I just respond quickly and encourage Elizabeth, if she gets an opportunity, to rewatch the beginning of this evening's meeting where Dr. Specker, who is an epidemiologist who works at South Dakota State University and has over 40 years of experience, provided some very detailed data with statewide trends and some information specific to Brookings County that's supplied to us by the South Dakota Department of Health. She would be one example of the individuals that has guided the information we've gathered thus far, and that all was shared at the top of the meeting. Those slides will be publicly available, and she's just one of a variety of experts that have counseled us as we've tried to understand how to move forward with information that is Brookings specific. So I'd encourage you to look at our slides. They're insightful.
They'll be on the website. And I was just going to add too, I do believe nothing would be interrupted with the school's ability to still serve those lunches. Is that correct?
That's correct.
Okay.
That and all non-for-profit essential
Yep.
services and human services needs will be available to people. So once again, people should know that they can do that even if the stay-at-home ordinance goes into place.
Okay, at this time I'll close the public. I'm sorry. I don't think so. Nope. Close the public comment. Council comments or questions?
This is Nick. If I could just share some thoughts.
Please, Nick.
I'm trying not to jump in to respond directly to each comment because I think there was definitely a theme in the comments and I didn't want to get too repetitive. First of all, I want to thank those of you that have shared your comments this evening and to those folks who have reached out over the past week in emails and texts and phone calls. They have been really helpful. When I requested a hearing of this first reading of the ordinance, I had two primary goals in mind. One of them was to better position our community to act quickly if this situation were to escalate. We've touched on some of those threshold points this evening. When I think of this situation escalating in Brookings County, I think of evidence of substantial community spread. Those are cases in Brookings County that are not linked to travel and have been confirmed by the Department of Health. Right now, Brookings is coded as minimal to moderate community spread, which means we have community spread, but it's not substantial yet. And so that would be a threshold for me. An outbreak in a single facility or in a certain sector, as I noted earlier, would be concerning. Or if we're continuing to hear concerns from our health system that might be related to capacity issues, or if they have concerns about their ability to deliver high quality care, that would trigger me to consider a next step. In a situation that's evolving daily, the 5-day window between the first and second readings could matter a whole lot. And that is part of why I wanted to conduct a first reading tonight. My second goal was to provide a venue to have a public conversation around an important topic and to hear from the community about the impact of our potential next steps. And tonight's conversation and the emails and the texts and the phone calls that we've received in the past week have been really instructive. Your feedback will help us continue to balance what we know is a tremendous public health concern and a very real economic anxiety that's coursing through this city. None of the decisions that we have made or that we are making are made in a vacuum. I know all of the counselors are doing this, and I can speak for myself when I say that I've gathered information from experts in medicine and healthcare and epidemiology and emergency management. I am working to understand the current testing capabilities in South Dakota. It's hard to get a real picture of what's happening on the ground in our communities because we know there are so many folks who are not getting access to tests. Trying to understand the capacity of our health system, also trying to understand the unique nature of COVID-19. We know that one of the issues is that asymptomatic folks can be carriers, which means they'll continue to go about their business in our community not knowing that they may be going to work or doing essential tasks and could be carriers of the virus. I'll also say, and again, I speak for myself, but I feel like my fellow counselors and I have tried to do this. I've worked to be transparent in my thinking and my decision making since this crisis started. I've written speak outs in the Register and shared notes on my council Facebook page and tried to respond to as many emails and phone calls as I could fit in a day. And I'll just say that, as is so often the case, what is happening in other parts of the country will eventually arrive in South Dakota. I know it takes time, and it feels like this is lagging in South Dakota, which is to be expected. But I think it's important that we're prepared. There are countless cities and regions of the country that wish they could wind back the clock and have an opportunity to better anticipate the wave that right now is lapping at our feet. And in my thinking, before it rolls in, I just want us to be ready to respond. And I think by holding a hearing on this first reading tonight, we are better prepared to be ready if this situation escalates.
Thank you, Nick. Councilmember Brink.
I just wanted to share a few stats from the Brookings Chamber of Commerce and their business survey that was from, I think, March 13th through April 3rd, just for community awareness and just in case anybody hasn't seen that data. Of the businesses that responded to that survey, already 50% of them, again, it was April 3rd, that's almost 2 weeks ago, they were restricting their spending. Only about 20% hadn't seen a change in their incomes or in their sales. Over 80% of them were thinking things would stay the same or get worse. And the question was, how long can you go without financial assistance? 16% of those that responded said less than a month. 40% said 1 to 3 months. 19.5% said 3 to 6 months. That's a lot, right? And 70% of those businesses cannot be totally remote. And so that's another reality that we face too. I also had a citizen that contacted me and said, I'm going through some tough times and I get very lonely. Being able to have 1 or 2 people at my house or be able to go for a drive without a destination is important to me and my mental health. I get depressed sitting at home by myself all the time. And I think that's a fair perspective to have in the public discourse as well. And one final thought is, my personal belief on this is that South Dakotans are good people. We want to do the right thing. You want to do the right thing for your neighbors, for your friends, for everyone in your community. And by and large, we're doing the right thing most of the time. So far, our mitigation efforts seem to be working. And I really just hope that we can continue to educate. And I think that's a very appropriate and important part of what government can do in local government. And we're doing a good job with that. We have some great social media. We have some great press releases and information out there. But I think the educate, not legislate phrase really rings true to me as one of your elected representatives, and I just wanted to share that with the group.
Okay. Thank you. Any other council members have comments?
Mayor Corbett, this is Oak. I'd like to speak if I could.
Okay, go ahead, Hope.
Thank you. I'll be short and sweet. I've engaged with citizens that have talked to me personally, and it's not been easy. I truly appreciate the citizen input and the opinions. I feel with the small numbers, what we are presently doing, it's working. What we're doing tonight will ensure what we have for if we have a major turn for the worse, we can act and the community can hunker down. I can feel with the gentleman about the assisted living. I haven't seen my dad for a month and a half. I got to wave at him at the window when I filled up his bird feeder. That's not easy. There will be better days, and what we do presently should make it easier in the long run to get back to normal when that time comes, hopefully sooner than later. As a business owner, I have felt the pain also. We've had delays, canceled jobs, and things are going to get stacked up. And when we're finally able to do some of these projects, it's going to be difficult because I've got to put a crew together that's going to probably have to try and do twice as much in half the time. But we have to rely on the advice of our health officials for guidance and make genuine efforts to get through this in a short period in our lives for everyone in our community. I've worked in some of the other communities of our size in South Dakota, and they're all doing the same things we're doing right now in one way or another. And what we're doing is proving that we can stop the spread by doing exactly what all of our communities are doing. We haven't seen any spikes in any of them. Obviously, Huron had a huge spike, but it was isolated. They haven't had anything since. Mitchell's only has 3, as far as I know, and they were travel related, and they haven't had any either. And they're doing the same things we're doing. We're not the only community that's suffering. I think we should continue this effort. I think this ordinance will not have to be enacted. If we can get through this, and hopefully people else can get control of what they have down there, and we don't see it come 45 miles north. I guess with all that being said, I appreciate everybody's tolerance, and we're going to do the best we can with the information that we're given and based on science and the direction of our health officials that we rely on for information. Thank you.
Thank you, Councilman Niemeyer. Anybody else?
This is Holly, and I would just like to say that I supported holding this first reading now primarily for two reasons. One was to allow for this public discussion to take place, and the other was to be adequately prepared in the event that circumstances do necessitate further action. I do want to thank every member of our community who has taken the time to be part of this discussion and provide comments. By holding this first reading, we are able to bring this topic to the public arena and provide this space to have this ongoing dialogue. We've obviously learned that 5 days can drastically change the number of COVID-19 cases in an impacted location. And in order to be adequately prepared to help protect the health and well-being of our healthcare workers, those most vulnerable in our community, and every Brookings citizen, we have to begin this process now so that we can be ready to respond if circumstances require it. There is no doubt that this is a very difficult topic to consider, and please know that all of the issues that have come up tonight, all of the questions, all of that, I take none of that lightly. This directly impacts myself. It directly impacts every person in this community that I know and love, and please know that it is something that I am taking seriously and poring over every single day. The impacts of this possible action are not lost on me, and I am aware of how devastating the impacts of inaction can also be in the wake of this pandemic. I can promise that I personally will continue to seek guidance from our local medical professionals, our hospital and our local epidemiologists and other health experts. Additionally, I'll continue to monitor the data that's provided by the Department of Health regarding the number of cases, the rate of our increase, the status of our community spread, and I will watch for any cases of outbreak in any one specific area in our community, and I will use those factors along with public input to help me determine if or when enacting this kind of proposed ordinance might be required. We are obviously all in this together, and I am so thankful to be given the opportunity to serve this community during such an unprecedented time. And again, I just want to thank everyone for bringing these comments forward today.
Thank you, Holly. Anybody else?
Mayor Corbett?
Yes.
This is Dan. I was going to wait till after a motion was on the table if it is indeed going to be a motion to table, but I, like Nick, wanted to give the public an opportunity to speak their mind rather than interrupting or going question by question. And so I do have maybe a overarching thought and our thoughts, and just do a few points I would like to make. Ironically enough, I do teach in the healthcare system. I am a healthcare professional. I am surrounded when I'm able to be on campus by a variety of other healthcare professionals and scientists, including epidemiologists and a whole host of other people as well. Today, in my honors colloquium class, I actually had a public health expert, a person with their PhD, presenting to my students about public health crisis, pandemics, how we respond to them, and going through the history of past pandemics and what we're learning in the current situation. And through that presentation and that discussion with future healthcare practitioners, doctors, nurses, pharmacists, athletic trainers, and so on, one of the things that's constant is that in a typical pandemic, we're able to go off of data, right? A number of people came up tonight and talked about active cases versus recovered cases and infection percentage and death rate and all those types of things. And the problem is as someone who does like to make decisions off of data, I think that's one of the roles I play on our council. The problem with the current pandemic is we don't have data. We have numbers that people like to quote when it's convenient for them, and numbers that people this pandemic versus maybe the plan that was put place in 2014 as part of a tabletop exercise in the community is that we don't have the ability to test people right now without a lag of at least a couple of days. We don't have rapid testing available. We don't have antigen testing available to see if somebody's already immune. So yes, currently, if you go on the Department of Health's website, it says that we have had 9 cases. We don't know that that's true. For all we know, we've had 90 cases. What we do know is that it's currently present in our community. It's currently present in the communities around us. And because we don't have accurate data to make decisions off of, all we can really do is make decisions based off what we do know and what we don't know. And unfortunately, there are so many unknowns right now that, in reference to the comment of, let's quarantine the sick, not the healthy. Well, unfortunately, when you look at pandemic planning, in order to quarantine the sick, you have to know who the sick are. And right now, we're not able to do accurate testing. We're not able to accurately measure where people have been, who they've come into contact with, and all those types of things. And that's truly how you can contain a pandemic and prevent a public health crisis. And unfortunately, we're really not able to do that. I don't think a shelter in place is the right action right now. Like others have said, I think it's important for us to have done a first reading, to have this conversation. Throughout this process, one of the common themes in those who are against the shelter in place, and even the first ordinance, was that people are currently following CDC guidelines. I am obviously not there present tonight, and I'm not watching on TV, but current CDC guidelines include social distancing. They include the wearing of a face mask, and I also know that social media went out today asking that anyone who attended the city council meeting wear a face mask. And one of my questions to the public would be, who are present, is how many of you are wearing a face mask? And I don't say that to point fingers or shame somebody who is or isn't following CDC recommendations, but the statement was made that the CDC is the gold standard, and that people are doing their part to try to prevent the spread of the infection. And so, I think it's important to make sure that we do check ourselves. That has nothing to do with me or anyone else taking away your civil liberties or your right to choose. If you choose not to do that, then that's a choice that you make. But this is a community effort. This is not something, when it comes to public health, that affects any one individual. And one of my disappointments in this process has been the theme that as city councilors, we don't recognize the gravity of the decisions that we make on a regular basis. It's not just today in the current environment of the pandemic, but when we make decisions on whether or not we spend $2+ million of taxpayer money to upgrade box shelter fields, or whether or not we need to look at changing a speed limit on a road or putting a stop sign on an intersection. I recognize the gravity of those decisions every single time I make a vote in city council. And the person who said it's not a popularity contest is 100% correct. It's not whether your feedback was 50-50 or 80-20. At least it's not for me. But part of it is data. And when we make decisions about traffic safety, we have traffic counts. We have ways to measure numbers and get data that we can make real decisions on. Again, in this case, we don't, and I think that's unfortunate. Yes, you heard, I don't know, or I can't answer that question tonight. You're going to hear that all the way through public office and even private enterprise right now, because there are so many unknowns, and it is unfortunate. But when we can get answers, I trust that we'll do everything we can to get those answers and to provide them from the public. Decisions are not being made in executive session, despite what maybe some are led to believe, because of the fact that we had 2 executive sessions last week, neither of which dealt with this issue. More than anything, what I do hope happens is that we do continue to have a civil discourse. I know other counselors can agree with me in that there was emails that we received that talked about how, we're dictators and how people are going to recognize the terrible things we're doing the next time that elections take place and things like that. And I don't, again, point those things out to shame any one person or the comments that they made, but realize that we're all trying to do the best that we can. And one of the things that I love about our form of government and especially local government is that we're part of a community and we're here serving our neighbors. I personally spent most of yesterday on the phone. I spent most of Saturday answering emails that I had received, returning text messages. And I do that because I care and I realize the gravity of this situation and the role that I play in it. And I think it's just important that that's true of anybody, whether they're a public servant, somebody who is working in city government, county government, state government, that they're put in a very difficult situation. And they don't wish that upon themselves or anyone else, but at the same time, they're doing their best to play their part and step up and do what's being asked of them. So my request to the public, beyond taking care of themselves and recognizing the hard work being done by those on the front lines of this situation, is just to keep in mind that what this really requires is civil discourse. It requires us to all take care of each other. And at the end of the day, when this is all over and brighter days are ahead, we have to be there, ready to help each other pick up the pieces and rebuild this community and rebuild this state and rebuild this nation and move forward as one. And to keep that in mind as we move forward.
Okay. Thank you, Councilman Hanson. Okay, Council, a lot of good comments from the public and the Council. Is there anyone wanting to make a motion and second to approve the first reading of the ordinance 20-006? Council, anyone want to make a motion?
So moved.
Okay, Nick?
No, this is Nick. I'll second.
Okay. So open Nick second.
Clarifying question, were you asking them to make a motion to approve it or to table it? What was the motion
No,
on the table?
to approve it first reading.
Okay.
Yeah. Thank you for asking. Okay, Council comments on that?
Just for clarifying as a follow-up to Leah's question, by approving this first reading, we are simply making a statement that the first reading phase has been completed, correct?
That would be correct. That's Steve Brightsman speaking, and that is correct. So that we have clarity that the first reading has been discussed, public hearing has been completed, and that the first reading is concluded.
Thanks, Steve.
Thank you.
Okay. Bonnie, please call the roll.
Hanson,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink, Corbett.
Aye. Okay, so the first reading is approved, and again, this just keep the process moving. Council, I've heard comments about a motion and second to table it. Is there any interest in tabling this motion until a second reading could be needed by the council?
This is Patty. I would make that motion.
Okay,
I'll second it.
Okay, we have a motion and a second to table the stay-at-home second reading until needed by the council. Any comments or questions? Seeing none, Bonnie, please call the roll.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink,
Aye.
Corbett,
Aye.
Hanson.
Aye.
Okay, ordinance 20-006 is tabled. Okay, council member introduction of topics for future discussion. Councilman Hanson, I think you said you had something you wanted to visit about?
Yes, I would like to make a motion. Thanks, Mayor Corbett. I would move to have the council in its upcoming meeting, finalize an offer that the Arts Council Director become a city employee. And I guess I'll leave my motion at that, and then I'd ask the right to make a comment. So my motion would be to finalize an offer that would make the Arts Council Director a city employee.
Okay, we have a motion.
Second.
Okay, we have a motion and a second. Okay, Councilman Hanson, you made the motion, so you can speak to it first.
Thank you, Mayor Corbett. The reason I make this motion is because I know this is something that has been talked about throughout the community, and you know, we've had discussions, or I've had discussions with the Arts Council Director as well as some members of the Arts Council Board and city staff with regard to this action, and I feel like a lot of discussion has taken place, and no action has really been taken, and so this is my way of trying to bring it to the council for the specific direction and specific action. You know, if you look back to our strategic goals as a council, one of them was to increase programming from the arts. And this is a way for us to do it, is by making the Arts Council Director a city employee, and try to leverage the resources and the progress that's being made by that group to better meet our strategic goal as a council. And so I would like to do it as a person who is a short timer here on the council. It's one of the things I'd like to do before my time is up.
Okay, thank you. Anyone else care to speak to the motion?
I have a question on that motion. I would like to clarify that the intention of it would be that the salary for that individual would be paid through regular city budget like any other full-time employee, and not in any way touching the Arts Commission fund dollars.
Turn to the city manager, because that's an operational question.
Once again, the question before us is to finalize the offer, make the council or the Art Council Director a full-time employee. I don't know yet what that means until I have the opportunity to really dive into it, bring you guys back a plan, and understand how it works. There could be an opportunity to look into those funds as a way to augment that, but once again, not until I start diving into the funding will I know. Unless council, from your perspective, is making an amendment that is a fund that we cannot touch for this purpose. But at the end of the day, I know and understand how valuable arts is to this community, whether it's for a project or for ongoing programming for the youth or adults within the community.
I'm not disputing that. I'm just simply wanting to clarify that, because I know that the intention of that Arts Commission fund was simply for public art and not for operational and programming types of functions. So I just want to clarify that wouldn't be part of it. So if I need to, I would ask to make an amendment that it would, as long as that funding comes through same as any other city employee, I would be all for it.
We can discuss that. So if approved by the council, we'll move that to the April 28th, which is our next meeting. So we can talk about it then, and we have a motion to move forward or not. Any other comments from the council about the motion by Councilman Hanson?
This is Patty.
Yes, Patty.
As I understood, and a couple of meetings that I had scheduled with Arts Council folks got changed because of what's going on right now. But as I understood it, I'm all in favor of it. I think it's a good way for us to be able to support what they do and help them not have to tap their budget for that. But as I understood it, the board was not interested in having their director be one of our employees.
Well, that's something we can look into before the meeting on the 28th, if that's all right, so we have that answer. Anyone else?
I'm fine with that.
I'm sorry.
This is Holly, and I would just like to clarify first that what we are voting on now is just to bring this topic to the next agenda. And second, if that is the case, then I would request that in addition to seeing a proposal of what that would look like, that we would also have input provided by the Arts Council so that we can see their view before making a decision as well.
Okay. Yes, we'll put it on the 28th, and we'll get in touch with the appropriate parties, if approved by the council. Anybody else?
Mr. Mayor, this is Oak.
Yeah, oh,
I would concur with Holly. I think it's just basically a presentation to us and to describe the position and its responsibilities and whether it is something that we should go forward with. I don't know if we need to vote on having that position on the next meeting.
okay, first.
Again, our vote is whether or not we want to have this discussion on the agenda, not whether or not we're approving it tonight. So as a point of order, we're having a conversation about something that's not in front of us.
Okay.
Okay, so it'll be on the 28th. Bonnie, please call the roll.
Tilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink,
Aye.
Corbett,
Aye.
Hanson,
Aye.
Niemeyer.
Aye.
All right, they'll be on the agenda. Any other items for future discussion?
If I can, real quick, Keith, a couple things I'd like to mention for tonight's discussion. Those people watching or in the audience, if you have any questions, and there's a lot of information that cities put out there, all of that is contained not only on our social media site, but also our website under the COVID tab. I encourage people to go out there. As I mentioned earlier, by Thursday, we hope to have a fillable form if people want to submit whether or not and ask questions whether or not their business is essential or not. I'd encourage them to go out there. Was notified right before the meeting, the Community Foundation is receiving a $30,000 match grant. I'd like to throw that out there to the public so everyone understands that that's a great opportunity for our community to help out in those non-for-profit communities. They are working with the United Way as well as individuals. So that $30,000 match grant is something that's great for our community that someone stepped up to offer. What's going to encourage people watching, if you know people that could give, encourage them to do so. I noted that we're working with the Chamber on a town hall meeting to discuss this issue with some medical providers. Once that information is set up, or that data is set up and the information can be given, we'll make sure and make that public via social media and press releases as well. Finally, we'd like to put a plug out there for our Engage Brookings app. Have a lot of people utilizing that. Great opportunity to engage the community, whether it's COVID questions, nuisance-related issues, or anything in particular that you might have questions on. Encourage you to utilize that Engage Brookings app.
Great. Okay, thank you. Entertain a motion to adjourn.
So moved.
Okay. All in favor of adjourning, say aye.
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 Opposed, same sign. We're adjourned.
Dan Hanson.
Has left.
Nick?